A very good afternoon to all of you, and I'm very happy to be on this platform. And I thank Dr. Tejas, of course, and my co-instructors, Dr. Jayashri, Dr. Reshma Javeri, and Dr. Senthil for having given me this opportunity. So let me start, saying that it's a wonderful talk that Dr. Tejas has covered up most of the aspects. But let me tell you that we need to think big. We need to take a very big step before we start moving from a solo to a group practice. The talk that has been given to me is how to form.
Sorry to interrupt you. Can you make it full screen?
Yeah. Okay.
Yes.
Yeah. So the talk that has been given to me is how to form a group practice. And I'm sure there would be a lot of overlapping. And Dr. Tejas right at the beginning has covered most of it. So we are here just to, summarize and give our thoughts. And let me tell you very seriously that the things you should know before starting, moving from a solo to a group practice is you need to think big. So that would be my suggestion. And it's very important that, for all of us to know how we negotiate our entry. And negotiation is very easy only if you know how to exit from the group practice, which I think I'm sure at the end of the talk, it will be covered by the expert panelists. So in my opinion, if you are entering, you must know the way how you are exiting also. And the most important aspect is that what common people like we are achieving, it's not very, it's extremely difficult. But the secret is what a team achieves is extremely important, and they achieve a lot of things which common people like us don't achieve. So in my opinion, this is an excellent platform to form a group practice. Unfortunately, I could not do it, but after hearing this topic, I think I would definitely love to start a group practice. Now let me talk about the vision. The doctors or the group who are forming the group practice must have a very, very clear vision, a holistic approach, and they should be very comfortable with each other. And in my opinion, they should be school friends, or they should be college friends, or they should be batchmates, so that each one of them know the negative and the positive aspect of each one another. So in my opinion, vision definitely holds the forefront. Now, how do we begin a project? So when you start, when you start beginning this project, it's extremely important that you have multiple meetings, multiple discussions before you jump into a group practice. And there should be a one person who would be coordinating things like staffing, directing, controlling, planning, and of course, organizing. Now, the processes that are involved for setting up a clinic and an operation theater, the most important is a title. A title has to be a neutral, so that everybody are contributing equally and everybody are getting their share. There should be a very excellent planning, like premises, area, interiors, equipments, diagnostics, surgicals, disposable, staff recruitment, maintenance, and of course the recurring cost. Now, how do we find the right people to join a group? And in my opinion, group is nothing like an extended family. They should align together and they should adapt together, like how we get adapted when we get married, isn't it? Come what may, we live with our family, we give life our family, we are looking into the family's ups and downs. So similarly, when we are in a group, if we have this kind of a mindset that we have to align ourselves and we have to adapt ourselves, then I think most of the job is done. Now coming to the era of super specialty, if I'm a cataract surgeon, now I have got into, cerebral palsy and eye problems. And, very soon we are coming out with a pro forma, which will be the first time in the country where eye problems have been neglected. Now from cataract, I'm moving on to cornea. I'm moving on to, cerebral palsy patients. I am doing, something levator, oculoplasty like LPS resection and things like that. So is it possible that I can be an expert in everything in the present era where there are so many super specialties? So why don't we think that, that we can distribute the work among the surgeons so that I'm not burned out and I'm not in touch with, with the latest technology of all the super specialties. So what more does a surgeon need? In my opinion, I think in this era of super specialty, we should all join together and distribute work so that we enjoy what we are doing today. Now, I have classified the team heads basically into these four categories: academics, economics, marketing, and of course, the mindset. Now, let us all agree on this point, okay, that none of us are perfect. But don't you all agree with me that the team is perfect most of the time? Because there's so many heads involved, so many specialists involved, and I think ophthalmologists are all highly intellectual people. So when we form a team, we are definitely more perfect compared to an individual person. Now coming to the academics, now let me tell you, the person who is into a solo practice, are they exposed to the skills that another surgeon is doing? Are they brushing up their theory? Are they developing the personality? Are they learning how to do research, innovations, how to interact with the surgeons, how to interact with your colleagues, how to interact with your patients? And this is extremely important in today's scenario because it's a competitive world. So as a surgeon, I always had a surgery phobia. When I did my first cataract, I remember how I was trembling with my superior seeing. And as a surgeon, in contrast to that, we always have a surgeon craze. Every surgeon has a craze to do the surgery because we are trained that way and we are made for that. So this is an ongoing process of academic excellence, which can happen only when you're in a group or when you're in a big institute. But since the topic is only a group practice, I would definitely say that when you're in a group practice, you are up to the mark. Your academics are superb, and you are well versed with the advanced technology. Now coming to the economics, of course we all want money, isn't it? And the income, expenditure, the self growth, perks, distribution of work and money, all this has to be very, very transparent. And at the end of it, having worked so hard during your undergraduate, postgraduate days, setting up a practice, we definitely need financial stability. It could be an active or a passive stability. Marketing within limits is nothing wrong in it. So the best persons to market your practice is are your happy patients. Of course, the electronic medias are there: WhatsApp, Telegrams, emails, TV interviews, and updating yours in a group with multiple specialities that you have, and giving them educational material. And of course, your receptionist and the staff, they matter a lot, especially in a group practice, because there should be no division amongst them. They should consider all the staff should consider all the consultants who are in the team as one. Now the mindset, definitely you'll agree with me that team is bigger than an individual. Whenever there is a problem, we have to definitely keep the team before us, and we have to put out all our personal gains and egos on the side. Transparency should always be maintained. If one of our colleague has any problem, we should always support them, involve all the team members in all the decisions that we are going to take. And this can happen only when you care and love, but at the same time, you must also have fun with your team members, and that only creates a bondage. So feeling of belonging in abundance, it plays a very important role when you're forming a team. Now, medical legal issues like, no, we have to have a lawyer, which an individual person cannot afford. So the agreements, appointment letters of the hospital staff, doctors, everything has to be in place. Indemnity of all the consultants. If you are, starting multi-center practice, then you have to have an MOU with the corporate hospitals or the charitable centers. And of course, the licenses, which in present scenario is a very difficult task. So let's take all this on our stride and stand by each other whenever there is a mishap. Why should you join a group practice? As Dr. Tejas Shah rightly mentioned, do you want the headaches of everyday administration? Light is not there, fan is not working, machine is calmed off, things like that. No, if I'm a skillful surgeon and if I want to improve my efficiency, lifestyle, and income, I would definitely like to be in a group practice, and I would, opt for it. Now, let's accept the facts that COVID has got us all down. Less patients, less surgery, less socializing, and you'll all agree with me that this is the right time and the best time to form a group practice, because then there's no financial burden to each one of us. And then, of course, we are also, doing our surgeries. So as intellectual community, we know where is our bread and where is our butter. So let's balance it out and move further. Now, the models of making an entry in group practice, I have basically classified into two, where a doctor, especially a beginner, has no money to invest and he can only get patients. The type two, where he can invest invest a small amount and get the patients. And the third model, where a person can invest in advanced equipments, where an average surgeon or a beginner will not have money to put in an advanced technology, and of course an experienced surgeon, and of course an invest in expertise. So in all these five models, I think it's the time which is very important, that one should give time to form this group and take it forward and run it all their life. So the best model, in my opinion, was that if there are some good practitioners who are well known and they invest equally in technology, there's no financial burden to any one of them. And they're all well established doctors, reputed doctors, like minded. So they don't have the headache of managing day to day affairs, and they would dare to invest because they are all established doctors. They would be having advanced technology which a common surgeon or a average surgeon will not be able to invest. So there is no surgical stress to each one of them. And I think, in my opinion, this should be the best model. So let me say that let's carve out a niche on the world map. Arguments, disputes, thought processes, they do happen, but let's not carry them. We are all having a different goals, different paths, and different ways of working. But the end point is, can we give the best to our patients? And yes, we can. It is possible only when we have a group practice. So my take-home message to all is, group practice is for strong-hearted. Know when to get in and when to get out. Keep emotions at bay and make sure that everyone is involved. Keep your eyes and ears open. Only medical work does not make you a great partner. Remember that, because we are so focused in our own education and in our own practice, that we always feel that we are the best, but it's not the case. And group practice in today's scenario is everyone's cup of tea. Do what suits, but at the end of it, remember, life should be fulfilling and life should be full of fun with all your expertise. And thank you for your attention, and stay home, stay safe. And I have finished with my talk.